You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, facial rejuvenation. Looking great for your age. With us, we have board-certified plastic surgeon, San Diego's plastic surgeon, Dr. Hollan. Dr. Hollan, welcome to the program.
Thank you. You failed to say first woman plastic surgeon.
Are you the first woman plastic surgeon here in San Diego?
I am.
Is that right?
Yes, sir.
How many years ago was that?
That was over 20 years ago.
20 years ago. And when you were out here, was that, I guess, a female plastic surgeon in San Diego?
Well, there were a lot of plastic surgeons, but I just came in.
Just came in first. Yeah. Okay.
I trained here at UCSD in plastic surgery.
All right.
And just stayed and joined the crews of joined the group of myriad plastic surgeons.
Okay. So private practice for about 20 years. And so before we start, for people that don't know you, tell us a little bit about the practice there with the team and what your role is and the different procedures you do.
Okay. Well, it's a team of 4 doctors that we do not work so much together as having our independent practices, but we're managed and have an office together.
Okay, good.
And we support each other in helping each other do surgeries or with any kind of difficult thing we want to talk about with somebody. So we're good partners, but we each have our separate practices.
Okay, so you're with Dr. Smoot. We're going to have them on the show. Dr. Sadrian. And you. So you guys are the plastic surgery dream team in San Diego.
Could be.
That's what somebody said to me, by the way, about you guys. So the procedures you do as a board-certified plastic surgeon, tell me.
The whole body is our territory, the external body. We don't do heart and lung surgery.
Okay, all right.
But we do facial surgery, which includes dealing with your eyes and your face and your neck, and ears even a part of, some people's rejuvenations are just things that have bothered them forever. That's sort of what rhinoplasty is.
That's nose job.
Nose job.
Nope. Okay.
Nose job. And they're done for multiple reasons. The most common is someone just doesn't like their nose. The second one is somebody's had some trauma and has a new nose that they don't like as much as their old nose. So that's one of the things we do. We do a lot of aging improvement things like facelifts.
Okay.
And we do upper and lower lids, brow lifts, mid-face lifts, and the neck is part of the regular face
We
lift.
talked on the phone. You say, Randy, I take my time. I may not be the fastest. I take my time. But you want natural results.
I do.
Okay. And one of the things, I posted already on Facebook. I took your picture in makeup, posted it on Facebook, and I said, we're talking about a natural-looking facelift today with Dr. Hollan, and it's obvious that she walks her talk. I know your age because you told me. And you look 15 years younger than your age.
Okay.
Right? I mean,
That's right.
So what you have accomplished, because you don't look done, as they say.
No, but I have had a facelift.
Oh, really? Okay.
Yes.
Okay. So is that the goal, that with every patient?
Yes.
To just look natural?
To look natural, to look like yourself, but better.
Okay. Your skin is good, too. I jokingly said you don't have any pores on your face.
I haven't been out in the sun very much.
Okay. So we're talking about facelifting today. What are the age ranges of the patients that you see?
From 35 to 90.
Is that right?
Both of those ends are sort of extreme.
They're coming in that young?
Well, not so much for natural aging, but many people that have lost a lot of weight may suddenly look older because they've lost the fat in their face and their skin has been stretched to accommodate the fat, and now they need a facelift. So facelifting is not all done for aging, it's done for people who've lost a lot of weight.
Okay.
That's the same thing with abdominoplasties. We see a lot of our patients for abdominoplasties are people who've lost a lot of weight, and then they have extra skin in lots of places, arms, tummy, abdomen, all sorts of places.
When you look at the face and you're with a patient that goes in and maybe they've self-diagnosed, I need a facelift, okay? What goes on in your mind?
Well, I kind of pull away from everything but the anatomy after I've really gotten to listen to my patient. I really don't just come in and say, okay, I see you need a nose job, I really listen to see what she has in mind. And I wouldn't say nose job anyway, I'd say rhinoplasty.
Rhinoplasty,
if I did make the slip.
I called it a nose job earlier.
Yeah, that's it. You trained me. So I actually listen to her and see what she's talking about.
Their goals.
Her goals. And while I'm listening, I'm looking and I'm seeing how her facial expressions are and how she uses her eyes and how she holds her head. And sometimes it tells us what's bothering her too, because she's kind of hiding.
What do they tell you, by the way? Do they want to look younger, different, rested? What is
Almost
it? Prettier?
Everybody wants to look like themselves, but better.
Okay.
That's sort of the way I put it together. I don't
What do
want
they say? I mean, what's
I
their
don't want to
wording?
look like anybody else. I don't want to look like a movie star. I don't want to look like I've been done. But I also want to make a difference. And so after they give me these things not to do, they say, but I still want to look young and fresh. And I don't necessarily need to look 25. I'm not 25, I'm 55. I wouldn't mind looking 40. And so they kind of guide me in that way.
And when you're and do you think of yourself as an artist, by the way?
Oh, sure.
You really do?
Oh, I do. Sure.
Do you see that end result in mind? I mean, okay, so the patient, these are my goals, this is what bothers me, my jowls, my neck, whatever, the bags under my eyes. Do you see the end result?
I can.
In your mind?
I definitely do. And the thing that can bother me is if they want to just do a limited procedure, and I know what's possible for them, but I can't do it. I have to do what is requested. Not so much like they dictate it. Together we create what the plan is. But for many people, it's limited by time and risk and money. So all of those risks,
Sure.
the risks of mainly time and money. So I just look and see everything, and then I listen to them, and I really, really, really have to sometimes just not push myself and go into something that is not what they want,
All right.
And so it's really designed between us. And sometimes I'll say, can I tell you what else I see? And the patient will say, sure.
Okay.
And then it may be the right thing. They'll say, you know what, I couldn't put my finger on it. That's what's missing.
How do you evaluate the face, by the way? Okay, so from the top down, the eyes.
I'm evaluating yours right now.
Oh boy.
Okay, so I'm just looking at you.
Okay.
And can I tell you what I see?
Sure, go ahead.
Okay, so you have a very smooth forehead.
Okay.
You have kind of peaked brows, which means that either this part is pulling down or this part's pulling up, or that's just your natural position. You have lower lids, which is probably your only area where there are any wrinkles, and that's just because the muscle's working and there's a little bit of extra skin there. And you have a nice jawline and a really good neck and good skin. So the only thing I would think about doing on you if you asked me to give you critique is something at your lower lids.
So it's taking care of this area right here.
Yeah, that's there. Now,
before we started, I was saying, I don't know what to have done. You go, I know what I could do for you. You raised your hand just like that.
That's exactly right. Yeah.
So same thing with a patient.
That's right. So I already I'm so visual that I see it, but then I don't jump to conclusions. Sometimes I used to make an error occasionally and say, oh, you're here for your eyes. No, I'm not here for my eyes.
Is that right?
That's not the best way to get related.
So you first obviously find out what they're trying to accomplish.
That's right. The whole goal is to do what.
But don't they ask you, doctor, what do you think?
Sure. But they really want to be, most people really want to be heard, and absolutely should be heard. And there are many people that have come in and said, I come to you because I was told you don't push me to do other things, and that's really true. I don't.
Okay.
And I've been to other people that said, well, you're just not going to have a good result unless you do X, Y, and Z. And the truth is, you'll have whatever.
Small things can make a big difference.
Small things may make a big difference, and if all that's bothering you is this small thing, then that's who we're doing this for.
Now, we talked on the telephone, and you said that you could do a facelift or some of these procedures, and it transforms their lives.
Yes.
Elaborate on that.
Well, most recently, in the last year, I've had 2 women in their 80s.
Okay.
And they decided that they needed a facelift.
Okay.
That they looked old and they didn't feel old.
Okay.
And I did a facelift on each of them, and I did perhaps less of a facelift on them than I would have done on you. Not that you need one, but
right.
age-wise.
Okay.
But it can tighten the skin beautifully, and they happen to have great bone structure. And one of the women had lost a great deal of weight. And so she had a remarkable transformation. She looked like
what does she say? What does she say?
She said, whoa. That's what she said when she first saw it. Whoa. She says, is this really me?
Love it.
She loved it. She just loved it because she'd always been heavier. And she'd lost the weight, and then that made her look considerably older.
So how many years younger do patients say that they look younger? Or can you make somebody look?
My patients tell me that they feel and look 10 or 15 years younger.
Okay.
And some of them have demonstrated that to me.
Like what?
Well, one young woman who had lost some weight and was already a little bit past her youthful prime. Started dating this really handsome guy. And he started coming to the office with her postoperatively, and I was delighted by her new gentleness. She really loved herself. She had been a little rough and a little argumentative and a little bit, tough in the world, and she was no longer tough in the world. She loved herself.
So does some women come in, they want to look like prettier?
Mm-hmm. Some want to look prettier. Some want to stop looking like someone else in their family that their aging looks like.
They tell you, people tell me I look tired or hungover. You told me in the green room.
That's exactly right. People say I'd get all dressed up, I put my makeup on, and I look in the mirror and I look like my mother or my aunt that I remember. and I look like I haven't slept in weeks, and I look like I'm just all burned out, and I'm not. I have a lot of energy. And there you feel a mismatch between the way they look and the way they feel.
I had a plastic surgeon come on my show one time, and I said, what's wrong with aging gracefully? And we're talking about facelifts. Mm-hmm. And he said, this is the new aging gracefully.
That's what I was going to say.
Do you believe that?
Sure, that is aging gracefully. Some people would say aging gracefully is accepting whatever there is, and if it works for them, that's perfectly okay. No one needs a facelift unless they feel they need it. Randy, if you don't like the way you look, it holds you back. It keeps you from going out in the world. It keeps you from presenting yourself to a new employer or to meeting new people. Makes you be shy at a party. It makes you kind of go back into the booth at work and just do your work there and not participate with people in your company.
So after a facelift or after some of this facial rejuvenation, people start becoming more social. Do they tell you? Do they say, hey, I'm more active?
Yeah, not everyone, but some people that want to be social and never could be, find a new way to do it.
So, but don't you think that it's possible? I mean, I see this, that the brows can be too high. And I feel like that's, 18-year-olds don't have high brows.
But they don't have to be too high.
Okay.
If you see them, they're too high, it may be a rare case that it's normal in anatomy for someone, but it may just be an overdone brow. And that's a technical...
Have you had a brow lift?
I've had a brow lift.
Okay. Yours don't look too high?
No, they're not too high.
Under the eyes. What are you doing for under the eyes?
Under the eyes.
The bags.
It's a really interesting area for me because it's a combination problem. It's extra skin, maybe. It may be extra fat, which is the fat that the eyeball is cradled in that kind of pooches out as you get older. Or it may be a droopy, not really droopy, but a lower cheek than is ideal. Okay. So it's a lower lid blepharoplasty if it's extra skin or fat. But if it's that and the cheek is down, then a mid-facelift may be your most beautiful solution to this problem.
You're big on the mid-face.
I'm big on the mid-face. I love the mid-face. I think that I've been seeing it my whole life in different people and wondering what the problem was. And no one talked about it much in early training. Years ago, we didn't do a mid-facelift. And so I saw lots of facelifts that were done nice and tightly here, but the cheeks were too low. And that meant that this area gets flat or there's no continuity between the cheek and the eyelid rim. And it is a really important thing to improve a face.
So a lot of facelifts aren't addressing the mid-face. Is that what you're saying?
That's right. A mid-facelift is not part of a, quote, classic facelift.
So gravity is hitting this area?
Well, everything
falling.
Everything falls. And so the cheeks fall. So they're down here. They don't look as good as if they're up here.
Okay. Right? All right.
And
so are you repositioning tissues to where they used to be?
Yes. Some people never had very high cheek pads. And then as they aged, it's worse. But even people that had high cheeks will see their little cheeks are now down here.
Okay.
So this is a procedure that's done deeper. It's not a skin procedure. It's moving the fat of the cheek pad. So it's underneath the fat.
So you're moving it up.
You're moving it up. So
can that sometimes take care of that bag?
It does take care of the bag because you do it through a blepharoplasty incision.
So my RN friends, and I'm sorry to interrupt, my RN friends that say, Reddy, you just put filler there.
I don't think so.
Okay.
So that's not your solution because you're not missing fat, you have extra skin in your case there.
Okay.
And it's just a little piece of skin.
Okay, so I just need a little bit of a lift.
You just need a little bit of a lift.
Okay,
But
okay.
one would consider a mid-face on you because you have very firm, strong cheeks, right? And you just consider it as an option because bringing that up might be helpful. But you don't have hanging here. You don't have nasolabial folds, you know, that we see. And you don't have marionette lines. So if you had those things, that would be really compelling to do mid-face. So I think you're more just blepharoplasty.
So mid-face, very interesting. You know, I interview a lot of plastic surgeons, and I've met somebody else that's known all over the world for his natural-looking facelift. And his gripe is, Randy, they're not addressing the mid-face.
That's exactly
They're filling in under the eyes when, in fact, they just need to pick that up a little bit.
That's exactly right.
You believe that?
Absolutely. You can try to deal with this area by tightening it more, but it just gets weirder and weirder.
Yeah, because, okay, good point.
Right.
Interesting.
So it needs to go up, and it's not the skin, it's the whole structure that needs to go up. So it's supported by putting it up here and supporting it up in the scalp.
Interesting. Why isn't everybody doing it? Somebody told me it's a delicate area, that there's nerves, things like that. They're afraid of the area.
Well, if you haven't done it, and if you're not comfortable with the anatomy, you shouldn't do it, and you do need to train to do it. And it's not something that we've all done.
Can you spot it at a party? Wow, they just had a pull instead of a mid-face.
Sure, but you know, I have an eye that's probably more acute than most people's.
Okay. So would you say that's one of the keys then to a natural-looking facelift?
Yes.
Is that mid-face? I didn't know that not all facelifts included the mid part of the face.
No, you would think so because the term sounds like it includes all parts of the face, but it doesn't include the eyelids and it doesn't include the mid-face. And that was just a terminology that was developed a long time ago. But as we get more precise in what the tools we can use and the techniques we use, then we add new things, and it doesn't fit into the classic description of facelift. So it is facelift, it is mid-facelift that's being lifted, but it's lifted as a whole unit, and it's a separate procedure.
You say the face doesn't just age in one place.
True.
Okay.
Gravity works.
And so neck and jowls alone, for every patient, may be a mistake. Elaborate on that.
Well, in some people, in younger people, it's usually just fine to deal with the neck and jowls. But if they lost a lot of weight, of course, it'll be a bigger project. But in people that have, specifically people who've had nice round cheeks, they'll often find that their cheeks have descended. And it doesn't look anatomically good. It doesn't look normal. And so when we do a facelift, we have to consider all aspects of the face. And the mid-face is often ignored.
It is. Okay, good. So you're one of the people that do that.
Yes.
And you're known. People need to know. And I'm not trying to endorse you, but you're known for natural looking facelift.
Right.
So neck and jowls. Let's talk about the neck and jowls for a moment.
Often the biggest complaint patients have. And it is often the biggest part of a facelift.
What do they say on the consult?
They say, my skin's hanging. I've lost my neck. I don't have the nice curve here, the right angle.
Okay.
And that's what we're going for. And that is part of a facelift. And a good solid facelift that we pay lots of attention to the neck and jowls is really the game we're
Can
playing.
a neck be too far gone, by the way? Like, for example,
No.
knowing you were coming on the show, I'm looking around and I see some very thin women and they've got these muscle, are they those bands?
Well,
Can you take care of those?
they're either skin bands or muscle bands or both, and you can take care of it. You may need to make an incision submentally to get at the muscle.
You could clean that neck up.
Yes, you can clean that neck up. You can tighten up the muscle in the front, and you tighten up the muscle in the back, and then you just re-drape the skin. Re-drape the skin.
Are they happy? Is that one of the happiest procedures for women with necks and jowls?
I think so, because it seems almost impossible to hide for them. You know, they can put makeup on the rest of their face, and that people come in wearing high necks.
Do they?
Yeah, and then to get their neck back is very, very
What's
happy
the
making.
biggest compliment a patient can give you? When it's all done, they're healed up, and
They come in kind of giggling and loving their look, love how they look, and they tell me I feel like myself. And it's not that they want to look like anybody else, they just feel like themselves. They look like themselves. That's the best compliment.
do they tell you, sometimes brag about the compliments they're getting or the looks from younger people or any of those
they
things?
sometimes do that, and sometimes they're just quiet with this big smile on their face.
Do you see them dressing differently?
Sure, absolutely. I tease some of my patients that we should probably have a built-in estimate of how much money they're going to spend on their clothes afterwards.
The most expensive part of the facelift is the clothing.
Clothes afterwards, yeah.
Is that right? So, a woman watching this, okay, and she doesn't like the way she's aging, okay? What do you want her to know about you and what you do and how you evaluate the face?
First of all, I want her to know that I'm going to listen to her.
Okay.
Because sometimes the first thing I do is go look, I see everything all at once. And I may be drawn to something like the neck. But for that patient, the neck may not be anything she cares about. And I'm going on and on about the neck. So I say, what bothers you? And then I listen.
And they say the eyes, the bags.
Right. And then I may suggest, well, does your neck bother you? Well, not much, but if you want to fix it, you can. That's kind of comes up sometimes. Or everybody in my family has a neck like this. And I said, well, do you still want to have a neck like that? And they may say, well, maybe not. So part of it's an educational thing about what's possible.
Okay, good. And so people don't have to look done.
No, don't have to look done
at all.
Is that
term, by the way, because it's used at lay people, we say.
We don't use it, but because it's not.
Is that their fear, though? Do they ever say that on the consult? They say, I don't want to look done.
Frequently. I don't want to look done or overdone or whatever they use to exaggerate it, or I don't want to look like I've had a facelift is really what they say. And I can understand that.
Husbands, a friend of mine, his wife was going to get a facelift. He talked her out of it, okay?
Oh.
And he said, and he's in the 60s and she's also same age. And he said, I don't want to look done. I don't want her to look like a freak, okay? And I said, maybe you need to find somebody that does natural work.
Right. There are a lot of us.
So what do you say to these husbands that are watching this, that discourage their wives?
If the husband's there and he's supportive, but he doesn't really think she needs it, sometimes I think his support is to not make her feel like she has to do it for him.
Okay.
And I say to him and to her that I understand I'm operating on you, the patient, and I know what bothers you because you've just talked to me about it, and nobody else, it's not anybody else's decision about doing this. And the husband's over there nodding, yes, it's not mine. I don't want her to do it because she thinks that I might want her to do it.
Do you think some men are afraid about the attention their wife may get by looking 10 years younger?
It could be, but I think more of them are just protective.
They're afraid that they're going to look strange.
Well, I think, they're afraid for two things. They're afraid that their wife is doing it so that they will still love her. And they, of course, want it clear that they love her, period. He loves her, not they. They're only one husband at a time, right? But, and that's the first fear. And he also wants to be, if he's there, he's supportive. He's not there contesting. So the husbands I don't get to speak to may be the ones that are not being supportive about it. But I really have to educate them that the husband, that this is going to just give her a new sense of freshness, and she'll still be herself, and she's not doing it for him. Okay. She's doing it for herself.
In this economy, do you look at it as an investment in yourself? Do you? Or could it be?
It can be. And where this comes so overtly is when there's someone who works in the corporate world who's a woman, and she's challenged anyway about moving up on the ladder, and if she doesn't look good, she tells me, I need to do this so that I can move up. Now that may not be every corporation, but that is a not infrequent concern.
Again, knowing you're coming on, I'm looking around, and I met a sales rep that came in, and this woman wearing a lot of makeup, impeccably dressed, but she looked exhausted, just tired.
So you got the effect of making a judgment about her, even though
like she was almost worn out.
That's right.
So when I see somebody that looks great at 60. It almost says something about them.
That they're vibrant and that they have the energy. And I think that gets expressed, that's probably what's being reflected. Not that corporate world wants someone to look glamorous all the time, but I think it has to do with they look like they maybe can't do the job.
And we talked in the green room. You said you attract people that want a natural look.
I do. I guess it's because people that get a natural look result with me have friends that say, oh, I like the way you look because you look natural. I've never had anyone come in and tell me they don't want to look natural.
Okay. Do you think you have an advantage because you're a female doing facelifts on females? And if so, why?
I think women feel much more comfortable with another woman about something that they're very sensitive about.
Okay.
And I can't say that my partners don't get a lot of business. They do. But I hear from my patients that they chose me, A, because I was a woman, and B, they got a good referral.
Without stepping on toes, though, here, do you think that you have an advantage as a woman evaluating the female face and doing a facelift?
Of course I do.
You do? Okay.
Of course I think I do.
Why, though? I want to know why.
Of course I think I do.
Give me the insight here.
Well, I've been studying female faces all my life. A, I have one. I have a mother. I have a sister. I have girlfriends.
Okay.
I've picked it apart. I see details, and I know those details matter. I've, lived in a woman's world.
Like, you know what women want.
I know what women want.
All right. Well, I want to thank you for coming to the show. Great information.
My pleasure.
They could go to your website, find out more about you. And
Yes.
Very nice. Very nice to meet you. And so we're talking about the Keys to Natural Looking Facelift with Dr. Hollan today. And it was a pleasure to have you on the show. And we'll have to have you back to talk about some of the other things you do. Because I know as a plastic surgeon, you do everything.
Absolutely.
All right. Thanks again.
Thank
you. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.